So let me just welcome everyone, and then I'm going to bring you up real quick, and then I'll take it over again. But I want to welcome you to our Wednesday night webinar. You know, on Wednesday night, what I love to do is to talk about a different topic as it relates to health, and then apply what we know about how CBD can be of a benefit. So for the whole month of August, we're really talking about conditions that affect the nerves. So last week, what did we talk about? We talked about sciatica and neuropathy. And we talked about how CBD can assist with symptoms that are due to sciatica and neuropathy. We know lots and lots of people who have neuropathy or sciatica. Well, tonight, we're going to talk about Bell's palsy. Now, some of you may have never heard of Bell's palsy or may know nothing about Bell's palsy, but it truly, truly is a very debilitating condition that we want to talk to you about, and we want to show you how CBD can really be of benefit. So tonight, I have a special guest here, Felicia Hamilton. She's a part of our Wakanna family, and she just wants to share a little bit about when she was diagnosed with Bell's palsy, what symptoms she was having, and then we're going to get into our discussion, and then we're going to bring her back for her testimony. But she just wants to share with you, she wants to say hello to you, and she wants to let you know how Bell's palsy presented with her. Take it away, Felicia.
Hi, Dr. Rita. So 3 years ago, I was under tremendous stress. I was having marital problems, problems at work, the usual problems with my adult children, but I was completely overwhelmed. And one morning I woke up and I was washing my face, and I stood up to look in the mirror and just was horrified by the vision that was looking back at me. My entire left side of my face was distorted, complete just drop. My eye was bulging, my face was just crinkled up and this agonizing look, and I just couldn't figure it out. And so I went to the doctor. I went to the emergency room actually, and they gave me a test to see if I had a stroke. And they said it's not a stroke, and they started running all sorts of blood tests. But what they told me is that I had a severe case of Bell's palsy, and that eventually it would relieve itself. It would just go away. But they did treat me with antivirals and some steroids to try to help alleviate the tension that my number 7 nerve, that's what they told me, my number 7 was infected, and they needed to treat it aggressively to try to relieve the stress my face was under at the time. And so,
Wow.
Yeah.
Mm-hmm. So I know that Felicia was diligently trying to find some pictures of what she used to look like, but we'll keep you in the loop, everyone that is joined tonight, because when she does, you know, find those pictures, we can really have a good visual of before and after. So thank you for sharing, you know, how this presented in your case. For sharing the type of treatment they gave you, which was antivirals. Thank you for sharing the fact that, you know, they didn't know if you had had a stroke or not. So those are some of the things that we're going to talk about right now. And then I'm going to bring you back for your testimony. Okay, so everyone, thank you for being patient. I know we started a little late, but they gave us time for people to get on the line and to hear Felicia's story. So I'm going to share my slides, Felicia, and I'm going to have you, you can mute out now. Let's see if this is my slideshow here. And it is. So welcome, welcome again, everyone. I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakanna. I'm a mom of 3 adult, amazing children. I'm also an obstetrician gynecologist. I've been in the field for 30 years, still practicing. In fact, you know where I am every Wednesday. Every Wednesday, I'm on call here delivering babies. But I've transitioned my practice into a lot of cosmetic surgery. So on the left, I'm doing a hysterectomy. On the right, I'm doing a liposuction as well as tummy tucks. But 3 years ago, you know, the CEO of this company, Melissa Boston, introduced me to CBD. I'd never heard of CBD. In fact, I always tell the story where I thought she was trying to sell me a lab, because CBC in medicine means complete blood count. You know, I told her I wasn't interested in being involved in a laboratory, but she said, no, Dr. Rita, it's CBD, cannabidiol. So we're going to talk about what CBD is in detail. But in the last 3 years, you know, I've been involved in the cannabis industry. In fact, here I'm testifying in front of the Judiciary Committee for the legalization of cannabis for the state of Illinois. The state of Illinois was the 11th state that legalized cannabis. And you may ask, why would a physician want a type of substance that we all know gets you high to be legal? And that's what we're going to talk about tonight too. We're going to talk about the negative stigma that still is surrounding this plant, but we know now that this plant offers hundreds and thousands of medicinal benefits. We're going to talk about those benefits tonight. So I'm here. The state of Illinois was the 11th state. The governor of Illinois asked me to testify, and my kids think I'm the coolest mom around because I'm an advocate for the cannabis plant. So as Felicia said, she said that when she was diagnosed, initially, they didn't know if it was a stroke or not. You know, when we talk about the cranial nerves, these are 12 nerves that typically are coming from the base of the brain and the skull that innervates different parts of our top part of our body, our head, our eyes, our face. And it's the seventh nerve, and she talked about that. It's the facial nerve that is damaged that causes Bell's palsy. So let's talk about the facial nerve, the seventh cranial nerve. You may remember this in anatomy, but many of you may not. But this is a very important nerve that innervates and really performs two major functions. One function is that it helps to convey sensory information from the tongue and the interior of the mouth, and this nerve is important in innervating facial muscles. And we know that the facial muscles are the muscles that control how we contract and produce facial expressions, right? We wouldn't be able to really smile or frown or make, you know, those kissy movements when we do selfies if this facial nerve is damaged. So it's a really important nerve. So Bell's palsy is a condition where the facial nerve is affected. It's very common in females. In fact, females between the ages of 17 or 30 are really most affected, but females in general are affected by Bell's palsy. And what happens when that nerve is affected, there is difficulty in eating and drinking. You can imagine if you couldn't move your facial muscles, you wouldn't be able to eat like you eat or drink like you drink now. We also find in Bell's palsy drooling, right? People are drooling because they can't control the muscles of their face. There's drooping of the face. There's drooping of the eyelids in the corner of the mouth because this nerve is innervating not only the jaw, the facial, the cheeks, but areas even on the forehead. So what we see typically is that the patient has a very, very difficult time or hard to close one eye. You know, there's problems smiling or grimacing or making any facial expressions. There could be twitching or a lot of weakness on the muscles of the face. and that causes dry eye or mouth because the innervation of the nerve is enabled to lubricate the eyes or the mouth. Patients typically can suffer from severe headaches and even a loss of sense of taste. So you can see here very easily where this condition could be confused with someone who is having a stroke. There's sudden weakness in the muscles on one side or half of the face. You heard from Felicia. She said she woke up, she looked in the mirror, and it was very sudden and acute. It could be a reaction to a viral infection. You know, there's some trigger that has brought on Bell's palsy. Felicia talked about the stress in her life, the stress of, you know, being a mom and children and a relationship that wasn't going well. It rarely occurs more than once. It's typically a one-time thing. And again, it's characterized by muscle weakness that causes one side of the face to droop. Again, the headaches, the facial pain, the jaw pain. And when you look at this picture, it could be confused with someone who's having a stroke. And she talked about that. She talked about being in the hospital and them doing tests to make sure it wasn't a stroke. So when you look at the difference between Bell's palsy and a stroke, it is hard to differentiate. But what you will find in a stroke victim is the arm drift, or typically stroke victims have an altered state of consciousness. Typically, they have paralysis of other limbs. It's not just the face. It's usually one whole side of the body. And then when you do an eye exam, there is unequal pupils. But outside of that, sometimes the fact that they have a drooping face or paralysis of the face or difficulty speaking can be easily confused with a Bell's palsy or stroke. So some of the things that we can offer patients who have Bell's palsy are exercises, you know, to strengthen the areas that have been weakened. Eyebrow exercises, lifting the brows up and down, moving the lips around, moving the nose around, moving the eyes around, neck and chin exercises too. But what Felicia said is very true. The treatments that we typically give our patients who have Bell's palsy is steroids. You know, we know steroids help to reduce inflammation, but steroids also have a lot of side effects. You know, one side effect us women hate is the weight gain. Prednisone, steroids typically put on a lot of weight. And also steroids can cause our blood sugar to increase. So diabetics who have Bell's palsy and have to undergo prednisone or steroids have issue with blood sugar. The other medications that we use are something called antivirals. So a cyclovir, FAMS, or Valtrax is another common name you may hear for Bell's palsy. And again, these medications, though are usually well tolerated, may have side effects, nausea, vomiting, as well as there are self-care products that we can use like artificial tears. Because remember, this seventh cranial nerve that's helped to innervate the eye can cause eye dryness, mouth dryness. So there are different devices that sometimes we have to wear, right? If there's severe loss of control around the eye, sometimes we have to wear and give eye patches. So let's talk about how CBD, how the cannabis plant can actually help to assist in symptoms for those who have undergone Bell's palsy, been affected by Bell's palsy. Let's talk about the cannabis plant as a whole family. It also contains more than 85 compounds, 85 cannabinoids we call them. But the two most common cannabinoids that the cannabis plant makes is THC, or delta-9 tetrahydrocannabinol. That's the part of the plant that gives you the high, the psychoactive part of the plant. The plant that gives you that paranoia, right? If you take too much THC. And then there's CBD, or cannabidiol. This is the non-psychoactive part of the plant. It's the part of the plant that gives you no high, it gives you no paranoia, but it gives you the health benefits without the high. We're going to talk about the health benefits. So when you break down the cannabis plant, there's two species. There's one species called marijuana. Again, that's the part of the plant that gives you high. And then there's the hemp species. That's the part of the plant that gives you the health. So think of hemp health without the high, and marijuana, we all know and heard of, gives you the high. Now, the difference between marijuana and hemp is very important. It's important that you understand that, yes, both species, both contain CBD, but at different amounts. Hemp contains large levels of CBD and very trace amounts of THC, whereas marijuana has very high levels of THC and trace amounts of CBD. So what is CBD? 3 years ago, I had never heard of CBD, but CBD is an abbreviation for cannabidiol. And cannabidiol occurs naturally in industrial hemp that we talked about. Again, CBD does not get you high. It gives you the health benefits without the high. And I'm going to say that again and again because we want to move past the negative stigma that the cannabis plant has had for over thousands and thousands of years. In fact, our products here at Wakanna are third-party tested. And we're going to talk about why that's important in this industry. Our products are compliant with the State Department of Agriculture. And that's really important because the cannabis plant or the hemp species is a bioaccumulator, which means that whatever is in the soil, if there's metal, toxins, contaminants, mold, mildew, if it's in the soil and hemp accumulates it, it's in your product. So you absolutely want a product that's tested like our products here at Wakanna. So it's really about learning and unlearning, right? Hopefully, many of you that are guests on the line now understand that there's a part of the plant called CBD that's non-intoxicating. There's a part of the plant called CBD that has receptors in the brain that help to regulate and mitigate pain, anxiety, nausea, and much, much more. So it's the health portion of the plant without the high, whereas THC is psychoactive. It gets you high. It stimulates receptors in the brain that stimulate pleasure. So that is the prime difference between CBD and THC. So let's look a step further. You know, when we look at this chart, we can really see that CBD has a lot of medicinal benefits, right? Many more than THC. THC, yes, may help reduce pain. Yes, it may help reduce nausea and vomiting. Yes, it can help improve muscle spasms, but it's the CBD that helps with so many other components, like being a very powerful analgesic. In fact, cannabis as a whole has been used for over 5,000 years to address pain. CBD also helps with nausea and vomiting. It helps to relieve a lot of seizures or convulsions. You know, that's how CBD really became mainstream when a little girl by the name of Charlotte Fiji's parents introduced her to CBD. She went from having over 500 seizures to 3 seizures a week. CBD also is a very powerful anxiolytic. And that's important because anyone who has Bell's palsy, like Felicia, I'm sure underwent more stress than the stress she was even under, seeing her face so contorted like that. And then CBD is a neuroprotective. This is the most important part of CBD's role in helping those and assisting those who have Bell's palsy. Why? Because Bell's palsy affects a very important nerve in our face called the facial nerve. the seventh nerve. And being a neuroprotective, CBD comes in, reduces the inflammation around that nerve, helps to restore the damage that has caused that nerve to be under attack, and it is a powerful neuroprotective. CBD is also an anti-ischemic, which means it helps to improve blood flow in areas not only in the heart, but the pancreas and other vital organs. CBD is an antispasmodic, so any spasms in the muscle, it also helps to improve that. And it's an antipsychosis, so it helps with a lot of mental disorders like schizophrenia. So how does it work? Well, it works by science. There's truly science behind how CBD works, and it's through the endocannabinoid system. See, this is a system that every single human being has. And thank God we all have an endocannabinoid system, because it's a very vital system. It helps to keep our body in balance. So when our body is out of balance, like in Bell's palsy, when the facial nerve is affected, when it is affected either by stress or a viral infection, whatever triggered that nerve to cause a Bell's palsy, the endocannabinoid system binds with CBD and it puts the system back in balance. So we have receptors throughout our entire body, right? We have receptors in our brain. And remember, that's where that facial nerve is stemming from, the brain stem, and then going into the facial muscles. There are receptors in the eyes, in the lungs, the liver, the kidney, the bowel, the skin, the stomach, the teeth, the heart, the adrenal glands, the uterus, the ovaries. Every single organ and gland in our body is looking for cannabis compounds like CBD, like THC, like CBD and CBC and CBG and CBN. All of the cannabinoids, 85 plus cannabinoids, are looking to be bound with the receptors throughout our body. So that's how CBD works. And that's how it improves symptoms caused by Bell's palsy. It binds to those receptors. It helps to reduce inflammation around the nerve to improve the condition. So when we look at our products here at Wakanna, we are very, very unique in this CBD space, right? We are considered at Wakanna the crown jewel of CBD. We offer products that are tested. We offer products that are compliant with industrial hemp registration. We offer products that are Farm Bill compliant. We're going to talk about the Farm Bill. And we offer products that are compliant with the State Department of Agriculture. And what I love about our products is we have products for everyone. We have products for those who may have random drug screens at their job. Those are our pure products, the products that are in white labels. And then we have tinctures, we have gummies, we have topicals, we have products you can cook with. We have products that help to restore hair. We have products that help to boost the immune system. So we have products for everyone. So the 2018 Farm Bill is a really important bill you should understand. And the reason why it's an important bill to understand is because this Farm Bill makes our product legal, right? We would never sell you anything that is illegal. So in 2018, the President Trump, he signed an agriculture improvement bill that now allows hemp to no longer be a Schedule I drug. See, a controlled substance is a substance that is deemed to have no medicinal property, no benefit, a severe safety issue, and a high level of possible addiction. That's where they put hemp. In fact, hemp was exactly the same schedule as cocaine, as LSD, as heroin. But we now know that hemp gives us the health without the high and should have never been a controlled substance. So that's what makes our product legal. And the Farm Bill specifically states that the CBD has to come from the cannabis species hemp. Hemp is defined as containing 0.3% or less of THC. Our products are tested. In fact, we've partnered with the #1 ISO laboratory in the nation. Green Scientific Labs is located in Florida, and we offer certificates of analysis on every single product. Why is that important? Well, it's important because you want to ensure that you're taking a product that has the proper amount of THC, which is 0.3% or less. You never want to take a product that has high levels of THC, right? We also test for mold, mildew, pesticides, heavy metals, toxins, residual solvents, mycotoxin. All of these contaminants, if found in a product, can cause a lot of damage, especially when you're dealing with someone that has Bell's palsy, especially when you're dealing with someone that is immunodeficient. They may have cancer. They may have HIV, AIDS. They may have a condition that if they're taking something that has mold and mildew, that wouldn't do anything to someone like myself, or if you're on the line and you're healthy, but it could cause a lot of sickness and disease if someone is immunocompromised or deficient. So here at Wakanna, we are excited. We have seen major growth in the year that we've launched our business. In fact, these 4 amazing women, well, I'm one of them, the 4 co-founders, we launched Wakanna in 2019 on April 20th, and we've seen 162% growth in our sales. Why? Because our products work. We know that throughout this global pandemic, so many businesses are going out, but despite the global pandemic, our revenue continues to grow. Why? Because our products work. Our products work, our products are safe, and our products are tested. And that's really critical in this industry. See, this industry is not yet regulated by the FDA. The FDA is looking to give you fines for making claims, but they still haven't regulated the industry. So what did we do as 4 co-founders? Well, we went beyond and above the call of duty by being transparent, by getting our products tested, by making sure that we bring the highest quality product to the marketplace. So just a disclaimer that these statements and products have not been approved by the FDA. If you're nursing, pregnant, on medication, please consult with your physician. You know, we have a medical advisory board here at Wakanna, a team of medical professionals that would love to speak with your physician, because if your physician is anything like I was 3 years ago, they may not know how CBD works in the body, and we really want to help them understand that. So please consult with your physician before taking CBD if you're on medications or if you have a medical condition. Real important. So how do you take CBD? Well, there is something called a tincture. It's an oil that you place underneath the tongue. And it's really important to hold the oil for about 60 seconds before you swallow, so that the CBD oil can be absorbed in these little glands underneath your tongue. They're called sublingual glands, right? It's important to understand not to eat, drink, or smoke for at least 15 to 30 minutes if you can after taking your CBD oil, just to get the optimum absorption from the products. So again, there are hundreds of medicinal benefits. In fact, there's 20,000 peer-reviewed articles that you can find as it relates to the medicinal benefits of CBD. Disorders also, not only Bell's palsy, but disorders like schizophrenia, epilepsy, anxiety, depression, attention deficit disorder, cancer, whatever you want to know about CBD as it relates to any health challenge that you may have, you can do that by using your favorite search engine and getting that information. So excited now that you really understand that there's a health without the high part of the cannabis plant. It's called hemp, and CBD absolutely is a benefit. So let's talk about one of our most potent products. Now, Hemp MD is a great product for that person that may have severe symptoms due to Bell's palsy. You're going to hear more from Felicia after we're done, but Bell's palsy can be mild or it can be really severe. That facial nerve, which innervates facial muscles around the eye, around the forehead, can not only cause a lot of pain, but can cause a lot of disfigurement in the face. So our Hemp MD contains 750 milligrams of CBD in a 15 ml bottle. You know, whenever I recommend CBD to my patients, my family, I always start low and slow. They did a study at the Mayo Clinic, and the study they did was with patients who had severe chronic pain. And even in those severe chronic pain patients, they didn't need that much CBD, about 2.5 to maybe 50 milligrams a day. So more is not better. Start low, start slow with 3 drops twice a day under the tongue, 3 in the morning, 3 in the evening, making sure you hold it for 60 seconds so the oil can be absorbed. Again, we can increase that dose all the way up to 15 drops twice a day, but there's no need to start out with 15 drops twice a day. Start low and slow and build up to that. Our next product is our Hempranium 500. Now, this particular product has a proprietary formula where we've enhanced our CBD with black seed, with turmeric, with peppermint, with carrier oils like MCT coconut oil and hemp seed oil. All of these oils synergize on a cellular level and help improve the inflammatory state that we see of that facial nerve in Bell's palsy. We understand that black seed not only is good for digestion, but it's good for the kidney and the liver. It's good for blood sugar, cholesterol, skin damage, and hair loss. It's an antibacterial and antifungal. In fact, there are studies that show that black seed helps to rebuild the beta cells of the pancreas. It helps to rebuild those cells that are supposed to produce insulin. Turmeric is an anti-inflammatory. When we talk about Bell's palsy, what do we talk about? That facial nerve being damaged, being inflamed. So it reduces the inflammation, as well as turmeric helps to improve so many other things like your heart health, emotional health, and memory. Now, the MCT coconut oil and hemp seed oil, those are carrier oils. They help carry the CBD into the cells, but they also have medicinal properties in helping to improve anxiety and mood. You know, we understand that any chronic debilitating condition, even if it's short-term and acute, like Bell's palsy, can cause a lot of anxiety, can cause a lot of stress, can cause a lot of depression. Just imagine you waking up and the whole side of your face is drooping. Causes a lot of anxiety. We have edibles. Our edibles, our gummies are amazing. Again, a different way of getting CBD into your bloodstream. Our power gummies are full spectrum. They contain the legal limit of THC, which is 0.3% or less, but they will not get you high. They are potent because our gummies are infused. See, we just don't coat our gummies with CBD. We infuse the entire gummy. So each gummy is 25 milligrams of CBD, our power products, and each of our pure gummies. You guys ready for this? On the website tomorrow, you're going to see our new 60 milligram broad spectrum gummies. So we have gummies for those who have random drug screens on their job. Those are our pure gummies in the white label. And if you don't have random drug screens, you can use our power gummies. Now, our gummies are very potent. So please, even though they taste good, they only contain 2 grams of sugar in each gummy. But even though they taste yummy, please start out with half of a gummy. Again, start low, and slow. More is not better when it comes to CBD. Our topicals. Now you're going to hear from Felicia about these topicals, but absolutely in Bell's palsy, you want to take our topical cream or oil and you want to put it right along the innervation of the facial nerve. Wherever that pain is, you're going to take that topical oil and you're going to rub and massage that nerve so you can get local relief. You can get a reduction in inflammation. Now, our topicals do not pass the blood-brain barrier. What that means is that if you have random drug screens at your job, you can use our full spectrum power topicals with no problem. And I know this slide is wrong. It's a typo. Topicals will not impact a random drug screen. And then our CBD joint and cartridges. Now, these are really good to obtain relief within 1 to 5 minutes. Our CBD joints and cartridges work within 1 to 5 minutes. So when you have acute pain due to Bell's palsy, you can use 1 to 3 pulls on our CBD joint or our CBD cartridge and get immediate relief. I love these fast acting products. Our CBD joint is 106 milligrams of CBD. Please do not smoke the entire joint in one sitting. No one needs that much CBD in one sitting. 1 to 3 pulls is enough. Our cartridges, the same thing. Don't vape the entire 100 milligrams or 250 milligrams in one sitting. You need 1 to 3 pulls, maybe 3 times a day is all you need. So why shop Wakanna? You know, we know that there's CBD products at gas stations. There's CBD products at smoke shops. There's even CBD products at video stores. And, you know, Phyllis Nash, our chief sales officer, said, Dr. Rita, I didn't know there were video stores still open. Well, yes, on 183rd and Dixie Highway in Homewood, Illinois, there is still a video store and they sell CBD. Now, would I buy CBD out of a video store? Heck no, because that CBD is probably not tested. I don't know where it came from. So our products are tested, they're third-party validated. We have certificates of analysis on every single product. We offer premium products at affordable prices. And we offer a 30-day money-back guarantee. Our products are organically grown. We have proprietary formulations on our products where we've enhanced our topicals, we've enhanced our tinctures, our gummies, our infused. We offer the highest quality products. And guess what? Our products are vegan. They're GMO free. They are organic. They're safe and effective. So that is why you shop Wakanna products and nowhere else. So at the end of this webinar, we're going to open it up because I want you all to hear this powerful testimony from Felicia Hamilton, who suffered from Bell's palsy. I want you to hear her testimony. But there are 3 types of people, right? Person number 1, you're on the webinar, you're a guest of someone, whoever invited you, guess what? They love you. They really wanted you to get this information because it empowers you now to understand that there's a part of the plant that gives you health without high. And who wants health? We all want health, but who wants health in a holistic, organic, natural fashion? Many Americans are now looking for CBD for that option. So person number 1 is you want to be a customer. You want to get these products in your system. You may not have Bell's palsy, but you may have other concerns and challenges that you want to address. And then person number 2, you have questions. We're going to hear Felicia's testimony, and then I'm going to take questions. So you can start putting your questions right now in that chat box. And then person number 3 is someone that sees an opportunity. They see an opportunity in locking arms with us here at Wakanna, and we're going to give you that opportunity to learn more about our business. And you can do that on Saturday. Now, this is probably last Saturday's date because Dr. Rita's laptop is being very disrespectful today and not loading proper information. But just know whoever invited you will get you to our business overview on Saturday at 10 a.m. So we're going to open up the line. First, we're going to hear a testimony from Felicia, and then we're going to take questions. So you can start putting your questions in the chat box or the Q&A box. Felicia, are you out there? Well, I want you to tell everyone the products that you use. I want you to tell everyone, how you were introduced, how you found out about Wakanna. I want you to tell them which products you use and the results of you using those products. You can also share about the other diagnosis that happened right after you found out you had Bell's palsy. But again, I want to make a disclaimer that we cannot make any claims, right? We can't make any claims that CBD can cure, treat, or mitigate any conditions. But what we can say is that we want you to do your due diligence, do your research, do your digging, do your finding so that you understand all of the medicinal properties that CBD holds. Take it away, Felicia.
So I just want to start by saying the face that you're looking at right now is less contorted, distorted than it was in June. In June, I became a Wakannapreneur and was encouraged, to try the products for pain. And so I did. And as I started listening in to some of the grand openings and just listening to everyone's testimony, on like a humbug, I tried to start using the topical oil and cream on my face. And I felt the immediate relief. I was getting a headache one day, and I usually get this pain right above my ear, and that's where I know my Bell's palsy is acting up. That's when I know that I'm having stress. And so I put some of the oil right here and I massaged it in, and then I brought it down along my jawline and my lip and just rubbed the oil and put the cream there. And I felt the immediate relief, because usually this side of my face is really tense. And as you can see, I still don't have a complete smile. And but this is more than I had in June. In June, my face was still distorted. I'm reluctant to take pictures, so I don't have any pictures to share with you. I've shied away from the camera since this Bell's palsy hit me a few years ago, because if you know anything about that little cartoon show, I think it's called The Boondocks, and there's a character on there called Uncle Ruckus where his face is all distorted. That's how I felt my face looked. And so I was horrified when I looked in the mirror. So I've shied away from cameras since then. But the relaxation that I'm experiencing on my face today, and since I've started using the cream, the topical cream and oil on my face, has been amazing. I also use the tinctures of power. I use it underneath my tongue. I do it twice a day. I take gummies. I wanted to experience optimal health in the best way. So I've just been using all of the products. I season my food with it. I use the water soluble. I use the nano in my shakes. And it's been helping with the stress, because like you said, Dr. Rita, the additional stress you have from having Bell's palsy is just as bad as the stress that brought the Bell's palsy on. And so anxiety, depression, the CBD has been helping to relieve all of that. And when I can look in the mirror and see a change, it even helps with that even more so. So for me, My testimony is just that using these products have been transformative, whereas doctors have suggested that I have Botox or some electrical type of charging to try to relieve this pressure on my face. The results are not as good, and they sound, they're very expensive, and it sounds painful what you have to go through to have any relief from Bell's palsy. Shortly after getting this diagnosis, I had a stroke, and so from more stress, just not being able to get through all the pain and stress. Your body's always in pain. My face is in pain. I'm never resting my face. For 6 months, I went where I couldn't even close my eye, like you were talking about earlier. I had to wear an eye patch just to close my eye at night. And then not being able to smile, that does something to your temperament. If you can't smile, you can't feel joy if you can't smile. And so I was just experiencing a lot of things, a range of emotions that were all negative. And since I started taking my CBD products, I feel better. And I think I look better. I don't look better tonight, but I look better on a normal basis when I comb my hair and do a little makeup. But I look forward to the day where I have my full smile again, and these products are helping me get there, because I don't have the stress that I had 2 months ago. Today, I can say that when I go to sleep at night and I take that gummy, I get a full good night's rest. I don't have that pain anymore. I rub a little oil on before I go to sleep. I don't get that pain in the middle of the night that I was getting from the earache, the joint. I guess it's that number 7 that runs down my jawline that starts to hurt, and it gives me a pain in my ear. So I just massage oil right along this line, and I'm feeling a whole lot better. I'm feeling a whole lot better. I can see my cheekbones rise a little bit more. I can feel, I can move my forehead muscles a little bit more, I can make a frown and probably, get the smile, but I can let you know I'm not happy, but I couldn't control any of that.
Yeah.
So it's a big change for me. And I'm just happy that I can share this with people out there who may be suffering, and offer them some sort of relief, because it was, like I said, it was on a humbug. I just said, you know what, let me try this. And now, so I'm testing the products out on myself. And I'm happy with the results.
Powerful, powerful testimony. I want to thank you for being so open. I want to thank you for being so transparent. I want to thank you for sharing, because like you said, there could be someone on this webinar that knows someone with Bell's palsy. There could be someone on this webinar that has Bell's palsy, and you have been able to open up with your testimony and share with us on how these products have helped. And the quality of your life has improved. The quality of life. There is no price tag on that, right? There is no price tag.
Not on your smile. When you can smile, your whole body feels joy.
Absolutely.
So this is restoring my joy. So I'm just going to keep using the products, and I'm going to keep you aware of what progress I'm making. So take a look at my face today, because by Christmas, I'm going to give you my full-blown smile, and it's going to be a lot better, I look forward to the changes.
Well, thank you so much, Alicia. We are so grateful for your share. Thank you, Minister Mooney, for allowing me to get the information about Felicia. He reached out to me when he saw that we were doing Bell's palsy. Thank you, Minister Mooney, for that. If there's any questions, please put it in the chat. We have 5 minutes before we're going to close it out for the night. But please share this information. There will be a recording, as there is on every Wednesday, but share this information with anyone that you know that is affected with Bell's palsy. We've had a seminar or webinar last week on neuropathy and sciatica. CBD is neuroprotective. We talked about this. It really helps to calm the inflammation of any nerve. It could be a facial nerve, it could be sciatic nerve, it can be any of the cranial nerves. We understand how CBD works. There's science behind how CBD works with very, very few side effects. So why not take that plunge like Felicia did to address your health in a natural, organic, holistic way? I was trained at a very, very traditional medical school. We didn't learn anything about herbs or plant-based medicine or alternatives, but I absolutely feel that patients are demanding that there are options. They're sick of side effects, right? We understand that there is a place in medicine for pharmaceuticals, but there's also a place in medicine for plant-based medicine, for cannabis, for CBD. So thank you, everyone. If there's no other questions, we're gonna let you go. Again, let the person know who invited you. If you're number one, you wanna get started on products, you're ready to be a customer. Number two, you may still have questions, so you wanna get over to that business overview that we're having on Saturday. Or maybe you're number three, not only do you wanna be a customer, but you wanna lock arms with us as it relates to being a business partner with us here at Wakanna. So have a great evening. Felicia, thank you so much. You were amazing. Thank you so much.
And I got to thank Minister Mooney as well, because he introduced me to these products and it's changing my life all the way around. So I thank Minister Mooney for inviting me along, because it's really transformative. Thank you, Dr. Rita.
Thank you so much. And thank you, everyone, and good night.
Good night.